Hello everyone, welcome back to my channel Codement Mastery. In today's video, we are going to study CPT modifiers part 2. In this video, I will explain the modifiers 51 to 59. Previously, I have uploaded part 1. You can check the video in the playlist CPT modifiers. Let's start. Before that, don't forget to like, share and subscribe to my channel. Let us start with the modifier 51. As you all know, modifier 51 is used to indicate multiple procedures performed by the same physician during the same session. It helps in correct billing of these procedures and ensures that appropriate payment adjustments are made for multiple services. So usually we'll give modifier 51 when there are multiple procedures performed by same physician during the same session. Remember this. Let us look at an example. During a single surgical session, a physician performs appendectomy and also repairs hernia. In this case, we will list appendectomy first and the hernia repair would be listed with the modifier 51 to indicate it is an additional procedure. So according to this case, there are two procedures, that is appendectomy and hernia repair. Therefore, first we will code appendectomy and after that we will code hernia repair along with modifier 51. By appending modifier 51, it will be understood that there were multiple procedures performed by the same physician during the same session. Let us look at the keywords for modifier 51. The keywords are different procedure and separate from. You can write down the keywords in your CPT manual below each modifier. Next modifier is 52. So modifier 52 is used to indicate reduced services. It is applied when a procedure is partially reduced or eliminated at the discretion of the physician. It may be due to various reasons such as patient condition or provider judgment. So when will we use modifier 52? We will use it to indicate reduced services, that is when a procedure is partially reduced or eliminated. For example, a physician is scheduled to perform colonoscopy, but due to patient's anatomy or condition, he can only partially complete the procedure. So how we will code this? We will use colonoscopy code along with modifier 52. That is to indicate the service was reduced because full procedure could not be completed. Because in the scenario, due to the patient's anatomy or condition, he could only partially complete the procedure. Therefore, we will append modifier 52. So why this modifier is given? It is given to indicate that service provided was less extensive than usual. Let us look at the keywords. The keywords are part of procedure not completed and partially. Next modifier 53. Modifier 53 is used to indicate discontinued procedure. It means that procedure was started but then stopped due to circumstances that endangered the patient's well-being, or it may also be other factors that made it impossible to continue. For example, a surgeon begins a abdominal surgery, but partway through, the patient's blood pressure drops to dangerously lower level, forcing the surgeon to stop the procedure for the patient's safety. Therefore, with the appropriate CPT code, we will append modifier 53 to indicate that it was discontinued due to patient's safety. Let us see the keywords. The keywords are procedure stopped before completion and discontinued. Next modifier 54. Modifier 54 is used to indicate surgical care only. So when do we apply modifier 54? It is applied when one physician performs surgical procedure and another provider handles the preoperative or post-operative management. Let us look at an example. Patient needs knee replacement surgery. The surgeon performs operation but then refers the patient to another physician for all post-operative and follow-up visit. So here a patient wants knee replacement surgery. So the surgeon performs only operation and he refers the patient to another physician for post-operative and follow-up visits. So how we will code this? We will append modifier 51 to the appropriate CPT code to indicate that surgeon is billing for the surgical care only without including preoperative and post-operative care. Let us look at the keywords for modifier 54. The keywords are only perform the surgical procedure. Next modifier 55. Why it is used? To indicate post-operative management only. This modifier is applied when one provider performs post-operative care while another provider has performed actual surgery. So this modifier is used to indicate only post-operative management. For example, a patient undergoes hernia repair by surgeon A. After the surgery, the patient is referred to surgeon B for all post-operative follow-up care and management. So, how we'll code this? We will use modifier 55 along with the CPT code to indicate that surgeon B is billing for the post-operative care only. In this case, we are coding for surgeon B. Okay, so we have to append modifier 55 to indicate he is responsible only for post-operative follow-up care and management. Let us look at the keywords. The keywords are post-operative follow-up only and continued care. Next modifier 56. This is also very easy. It is used to indicate pre-operative management only. It means that one physician performed pre-operative care and evaluation while another physician performed actual surgical procedure. Example, a patient needs hip replacement surgery. Physician A conducts all the pre-operative evaluations including physical exam, diagnostic tests and risk assessments. Afterward, the patient is referred to surgeon B who performs actual surgery. So, how we will code for physician A? He is conducting pre-operative evaluations, right? Therefore, we will use appropriate CPT code along with modifier 56 to indicate that physician A is billing for pre-operative management only. Let us look at the keywords. Keywords are pre-operative evaluation only. Next modifier is 57. It is used to indicate decision for surgery. This modifier is applied to E&M service that resulted in initial decision to perform surgery, typically on the same day or the day before the surgery. For example, a patient visits their physician with severe abdominal pain. After evaluation and examination, the physician determines that an emergency appendectomy is necessary and he schedules a surgery for the same day. So here there is decision for surgery, right? Therefore, along with the E&M code, we are going to append modifier 57 to indicate that E&M service led to the decision for surgery. Please take notes. Let us look at the keywords. The keywords are decision to perform surgery and surgical determination. Let us look at the next modifier, that is modifier 58. It is used to indicate a staged or related procedure or service by the same physician during the post-operative period. Okay, highlight post-operative period. This modifier is applied when the subsequent procedure or service is first, whether it is planned or anticipated. Second, more extensive than the original procedure. Third, for therapy following a diagnostic surgical procedure. Let us look at the example. Debridement of skin, muscle and fascia for necrotizing infection of the abdominal wall without facial closure. 5 days later, the abdominal wall was closed. Okay, so here we will report the circumstance by adding modifier 58 to the staged or related procedure. So here we are coding for closure, that is 13160 along with modifier 58 to indicate staged or related procedure or service by the same physician during the post-operative period. The keywords are return to the operating room. Next, modifier 59. This is very commonly used modifier. Modifier 59 is used to indicate distinct procedural service. So, we need to understand when it is applied. It is applied to identify procedure or service that are not normally reported together, but they are appropriate under certain circumstances. Please take notes. Let us see when to use modifier 59. We will use it when a procedure or service was distinct or independent from other services performed on the same day. Secondly, for procedures or services that are not typically bundled together, but in this instance, it should be separately reported. For example, a patient undergoes 2 procedures during the same visit, that is removal of skin lesion and excision of a cyst on a different site. How to code? First, we will code lesion removal. Secondly, cyst excision. CPT code with modifier 59 to indicate cyst excision is a distinct service from the lesion removal. Let us see the keywords. Additional services, separate procedure. So that's it for today. In the next video, we'll continue with part 3 of CPT modifiers. That is modifier 62 to modifier 90. So stay tuned.